Yeah, study this question perfectly. Here, question number 1, 25. Okay, let me give you an idea. Now here, yes, a nurse is briefing her colleague about a patient. What does she warn her colleague about? So this is a warning. Every question depends on a problem. Remember that. You hear a nurse. A nurse is briefing her colleague about a patient. Yeah. A nurse is briefing her colleague about a patient. So this nurse is the she. Okay. And this colleague is here. About a patient. That means she is warning about a patient. You understand that very carefully. There is some problem with the patient. There is some problem with the patient. About a patient. You know that very clearly. Now see how the clues are maintained here. See how the clues are maintained here. Now the nurse means a she. Her colleague means her colleague. About means about. About a patient, we know that. About what? About the patient. So what does she warn? So this is a warning. This is a warning. This briefing is a warning actually. This briefing is actually a warning. Okay. This briefing is actually a warning. Be patient when I'm explaining you. This briefing is a warning. So that means there is nothing important here other than the warning. Warning means a problem. Is she warning about the patient is allergic to some types of antibiotics? Is she warning regarding the allergy? Okay. Right? Right. So no, she is warning regarding some antibiotics. Some types of antibiotics which he is allergic. So be careful with antibiotics regarding this person. That is the meaning. So allergy is not a problem. These antibiotics are the problem because they are causing allergy. Then, is she warning about falling? The patient may fall down. So care should be taken because he may fall down. The patient may fall down. That's the problem. Antibiotics is the problem. Falling is a problem. And becoming breathless is a problem. 1 minute. 1 minute. Okay. So becoming breathless is a problem. So now these are the problems you can notice there. Now let us see what are the problems here. The problems I am giving in red. Antibiotics are a problem here. Falling is a problem here. And becoming breathless is a problem here. So these are the problems. She is warning about the problem. In case antibiotics may give allergy, okay, he may fall down. So care must be taken so that he will not fall down. He may become breathless, so oxygen is needed. So antibiotics is related to an allergy. Allergy to antibiotics. Antibiotics is the main problem here. Okay. The next one, falling is the main problem. So care must be given. Care must be provided that he will not fall down. Prevention is important before falling down. The patient may become breathless, so oxygen should be given. Oxygen may be needed. So the main things are antibiotics. Focus on antibiotics. Focus on falling down. Warning about a problem. So which is the most important problem you have to notice? He may become breathless. So focus on these areas. Focus on these particular areas. Okay. So right. Now, antibiotics are falling down. He cannot stand straight, falling down from the bed or standing, walking, falling down, or breathless, breathing problem. Okay. Right. So focus on these three words. Warning about antibiotics, or warning about falling, or warning about breathlessness. So the patient has a problem. What is his actual problem now? Maybe all the three problems he has, but they may be recovered, or we can be recovered, or no problem, something like that. So print a screen. Okay. Right. Now, if you see very carefully, I'm going to play the audio now. I'm going to play the audio now. Okay. Okay, OET official writing sample test now. Sample test 1. Okay. Okay, not here. Yeah. So listening. This is listening sample test. I'm going to play part B.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well.
Good.
Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable, oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain, with good results. She has an 18 gauge in her left arm.
Yep.
She's got normal saline at 15 mils per hour.
Okay.
Question 26. You hear the manager of
Okay. Now, yes, that is what you have heard. No need to hurry, relax. Okay. I'm going to show you something. Okay. Right. Don't write the answers, please. I did not ask you to write, no? Did I ask you to write? No. So wait, because I'm going to give you the option of how to do it. Okay. Hide floating meeting controls. Yeah. Print a screen. Okay. Yeah. So let me check pink. Okay. So okay. Okay, fine. Now I'm going to show you the options here. The options for this question. Okay, the options for this question. The options are like this. Okay. Telegram, create poll. This is LB0001. Listening B. Okay. Create poll. LB dash 0001. Okay. Fine. And the answers are A, B, C. Why are we going into Cancer? Not here. Here. Okay. A, B, C. Quiz mode. Inductive and deductive reasoning or approach. Yeah. So now you have to know which is the right answer. So you already got the right answer or not, you can check it out. So here is the question. I'm pausing the screen for a second because I have to feed the answer. So listening, answer key. Okay. Okay. Right. 25. I'm feeding the answer now. Yes. Now I'm passing, resuming the screen. So you can go here, copy, post link. I'm putting here, just learn how to, this is called a discipline, learning discipline on this platform. Okay. So that others will not know what we are doing and we will not know others what they are doing. So now there, click on that one. Okay. And you will go to the copy message link. Now go and type your answer, whatever you feel right. A or B or C, click on the bubble. This is bubble A, this is bubble B, this is bubble C. So only one student has given the answer so far. So you can click on that one and you can get the answer A, B, C. I have given you two links right now for question number 1. Question 1. LB listening B 0001. That is 25. Yeah. So that is the question number 2. 2 people have given the answer. What about the others? Come on, go and click the answer there. Here. Yeah. 5 answers. Yes, that's it. 6 answers. Very good. All of you have given the answer. That's awesome. That's really awesome. Fine. So now let me explain. Okay. Let me explain how to find this answer. I'll give you an idea how to find. This is called inductive and deductive techniques. Okay. The answer is here 25. That is B. The answer is 25. That is B. Okay. Now that's fine. Till there, it's okay. Now next, okay. Till there, it's okay. Right. Now what more we are going to do here is we have some standard style of finding out the answer. Okay. Now let us see here. Now this point. Okay. I have posted there. The next one, this one. I'll arrange afterwards. Just bear with me. Okay, that's fine. Little difficult, but I can do it for you. And here. Okay. Yeah, I think that is enough. ABC all have come here. Now I'm going to show you something different so that you can judge whether your answer is right or not. Okay, file, open. Yeah, official materials, listening test 1, audio script. Yeah. Thirteen to 24, 25. Yeah, here it is. 25. Question number 25. Here it is. Right. Okay. Better to take like this. Okay. 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 This is fine, I suppose. This is okay. This is also okay. Okay. So everything is 24. Yeah, that's perfect. Now, here use your points. Here are your points. Now look at this very carefully. Yeah. Now look at this one now. You can understand. Fine. Just to try to understand some questions, then you can understand each and every question. No need to understand everything. So you hear a nurse briefing her colleague. Briefing, actually this is briefing. She's briefing something actually, but this briefing is a warning. Warning for some danger. So danger, what is the dangerous thing? What is the alarming thing? What is the problematic thing? That is antibiotics here. Antibiotics are a problem. Here falling is a problem. And here breathlessness is a problem. So these are the three problems. These are the three problems. Now these three problems you have to identify here. Yeah. No allergies. So allergies is here. Allergies is here. Okay. The next one, allergies here. Allergies. Okay. No allergies. Okay. No allergies. The next one. Here it is allergic. And here is no allergies. So try to understand how it is. Try to understand how it is. She has no allergies. Here the patient is allergic. So how the statement and the original thing is contrasting. Okay, next one. Falling. Falling. Here is falling. Right. She is at high risk for falls. She is at high risk for falls. High risk. Too much of a problem. Alarming, warning. Okay. Due to her dizziness. She has a problem that is called dizziness. Because of this dizziness, she has a high risk of falling. Right. That is second one. Then third one is breathlessness. So shortness of breath. Shortness of breath. But the shortness of breath is only some, mild. And this is some and mild. Not great and malignant or harmful or dangerous. You have to know there. You have to know that there. Okay. Right. So try to understand the point here very clearly. Try to understand the point here very clearly. All the three things have come here. Now let me analyze these three things for your sake. Okay. So warning is related to antibiotics. Warning is related to falls, or warning is related to breathlessness. Okay. And now this antibiotics is related to allergies. Okay. Antibiotics is related to allergies. She is allergic, but she is not allergic. Falling, prevent falling, care must be taken. Yeah, she has a dizziness. Okay. And that is why she may fall down. Okay. She may fall down. And the risk is very high. High risk. So warning. And shortness of breath. Shortness of breath is very mild. So it is not a warning. Mild. Mild, moderate, and okay, benign, high. Okay. Mild shortness of breath. And oxygen is stable. Oxygen is stable. Okay. Vital signs are stable. Oxygen saturation is 98%. Okay. 98%. So you can see there. So now let us rule out the answers here. This is allergic. That means this is positive. This is positive. This is positive. This is positive. Is allergic. This is positive. This is the patient is allergic. And here the patient is not, has no allergies. This is negative. This is negative, means minus. So this is not matching. This is not matching. This is right because this is in the statement. This is right. No allergies. This is right. There is no allergy. The patient has no allergy. This is right. But this statement, this is a chance, maybe right or wrong, but this is everything right. This is right, but this may be right or wrong, but this is always right. So no allergies is right, but he says has allergies. So this is ruled out. This is ruled out here. Okay, this is ruled out. So this is wrong choice. So A is not the answer. Next one, mild shortness of breath. So there is no risk. Okay, there is no risk. Patient will not become breathless because vital signs are stable and oxygen saturation is 98% on 1 liter. And she has been comfortable during my shift. So why will she become breathless? So this is ruled out. C is ruled out. This is called a deductive method. So you eliminated elimination process. And now inductive method. High risk for falls. Falling, there is chance of falling. So you have to prevent her. Due to her dizziness, she is at high risk. So you have to prevent her from falling. Care must be taken. That's it. Care must be taken. That's it. So this is the right answer. You can understand that. All the three things will be there. But in the statement, if she says no allergies, and in the option she says yes, she has allergies, that means that answer is wrong. So this is the value of the statement. The statement may be true or false. So first statement is false because the original person is speaking and she is telling that, okay, no allergies. And the option is telling, yes, she has allergies. So the option is wrong because the passage is not wrong. The audio is not wrong. The audio is always right. Okay. Audio is always right. But the options, out of the three options, she has allergy. The patient is allergic. Means it is wrong. Because the passage says she has no allergies. So A is ruled out. Next one, she is at high risk for falls. High risk for falls. That means there is a chance for falling. Falling, high risk, means warning. Risk means warning. Okay, problem is there. So it is a warning. High risk is a warning sign. Okay, alarm bells are ringing. So you have to take care that she will not fall. So you have to prevent, because she has a problem called a dizziness. She may fall down at any time. Whenever she feels dizzy, she may fall down, collapse then and there. Any words may come, words may change and come. So care must be taken to prevent the patient from falling. That's the point there. So this matches. Third one, oxygen may be needed if the patient becomes breathless, but her assessment is within normal limits, except for some mild shortness of breath and wheezing. Some mild shortness of breath, only mild shortness of breath. It's not very harmful. Mild, very less, very, very less. Her vital signs are stable and oxygen saturation is 98% on 1 liter. So you can understand, the patient is comfortable during my shift. The patient has been comfortable during my shift. Okay. No problem with breathing. No problem. So why should it be a warning? No. So that is ruled out. C is ruled out. So the only other option, that is inductive method, is B. Falling, there is a chance for her to fall down because of dizziness. High risk. So be very careful. That's the point there. Print screen. Yeah. So here, this is inductive and deductive approach. That's it. You have to apply like that. You have to apply. So I hope you understand